Stevens-Johnson syndrome. So here the body surface area which is involved is less than 10%, and looking at the causes, and this can be basically, it can be drug induced. Drugs what we see are cephalosporins, and next it can also be the sulfur drugs and the allopurinol. Now next, moving ahead, what are the associated symptoms of the Stevens-Johnson syndrome? It can include fever. Next, it can also include malaise, and there can also be presence of headache. Next, what we are looking at is the mucosal lesions. Now, the mucosal lesions are several compared to the other disorder. It is severe, several. And now looking at lesions. The lesions, there are vesicles, and it is on the erythematous base. Next, there are also erosions. There are the purpuric macules. Next, there are also flat atypical target lesions. Okay, there are atypical target lesions, and then there's something known as Nikolsky sign. So the Nikolsky sign, it is positive. So Stevens-Johnson has a positive Nikolsky sign. Now looking at the distribution, how was the Stevens-Johnson distributed? So looking at the distribution, it is a variable. Distribution is totally variable. And now how is the histopath? Histopathology, there is a dermoepidermal separation. Okay, and there's also intense inflammatory cell infiltrates, and they are present in the dermis, and there are some areas of the epidermal detachment. Now we are looking at the recurrence. So the recurrence in case of Stevens-Johnson syndrome, it is rare in case of the recurrence. And now looking at the mortality, how is the mortality of Stevens-Johnson? There's increased mortality. Okay, another thing to note is that this recurrence, it is drug related.